11th. This is from our OBGYN JAMA journal for American Medical Association. Characteristics and outcomes of women who give with COVID-19 giving birth in US academic centers during the COVID-19 pandemic. So here's the bread and butter of what we want not to happen. This study showed, it studied 869,079 women, 18,000 of them had COVID-19. Women with COVID-19 during their pregnancy had increased risk of preterm delivery, 5 times more likely to be admitted into the ICU as the pregnant women, 3 times more likely to need a ventilator, and 10 times increased risk of dying. 10 times increased risk of dying if you get COVID-19 when you're pregnant. So we don't wish this on anyone. What about infertility? What is, and you know, I thought about this too. I have a daughter, she's 23, love of my life. And we wanted to understand about infertility. So there's evidence already, and we know from vaccines, from our study of vaccines for the past 70 years too. There's no evidence or even a biological plausibility. It's not even biologically possible that the COVID-19 vaccine could cause infertility in either men or women. That's from Dr. Denise Jamieson, professor and chair of the Department of OBGYN at Emory University and member of the American College of Obstetricians and Gynecology. And she's the on their practice advisory board for COVID-19 vaccines. People have received any of the 3 COVID-19 vaccines have not had increased complications with pregnancy compared to before the pandemic began. So people who have the COVID-19 vaccine are not having any more trouble getting pregnant than the rate was before the pandemic.